Howdy, the name's Johnny Ray, and today I'm going to be talking about surgeries. Because of MPS, I've had several surgeries at an early age to correct issues and give me better quality of life. There is a couple procedures that may have nothing to do with my MPS, but I wanted to include them anyways. There is one procedure that I've had that has made me especially anxious about doing a surgery. Even though I trust the surgeon doing the operation, I just can't help but get anxious. For these first few surgeries, I have no memory of them or what order they were done in. The only reason I know about them is because of my parents. Even then, they were rarely brought up. The first one I could think of was because of a hernia. For those that don't know, hernias are bulges that occur in the stomach or groin when there's a hole in your muscles, so organs can come through. Unfortunately, I don't know where the hernia was. For the next one, I have no idea what it was called or details really, but the main thing that I remember is my mom saying that my stomach flipped on itself or something along that line. I wish I had more information on that surgery, and I'm sorry about that. For the last procedure that I have no memory of is for ear tubes. I guess it was multiple procedures because I've had several sets of ear tubes put in. Ear tubes are these tiny hollow tubes that are put into your eardrum to maybe help your hearing and prevent ear infections. I had ear tubes up until a couple years ago when my ear doctor removed the one that was still in my right ear. After that happened, I do remember reading that you're supposed to have them taken out. And if that's true, then whoops. I was never told that they were supposed to come out, so maybe the doctor didn't tell my parents that, or whatever I read wasn't true. Alright, now on to the stuff that I do remember. This first one is the reason why I am scared and anxious about surgeries. And this surgery would be my first portacast. During this procedure, I basically kind of died. What had happened was that because my airways are so tight due to my MPS, they didn't have a small enough intubation tube, which is used to keep the airway open, immediately on hand. Because of that, my lungs collapsed and I stopped breathing for a little bit. So yeah, that was a little scary. They also brought up something about a leaky heart valve, but I don't remember much about that. So yeah, what was supposed to be a day of surgery and immediately going home turned into a 5-day stay at the hospital. In case you haven't watched any previous videos, a portacast is a device placed under the skin and used for treatment or taking blood. For me, I am infused through it with my medication, specifically for my MPS, weekly. I have the port so that way I wouldn't have to get stuck with an IV in the arm every week. This makes it easier for me and my nurses. For the next procedure, it's actually going to be 2 surgeries, but they were for the same thing, and that would be my carpal tunnel syndrome in my wrist. Carpal tunnel syndrome is where there is pressure on the median nerve in your wrist, which can cause numbness, tingling, and weakness in the fingers. For me, for as long as I can remember, I have never had complete feeling in either my index or middle fingers. I'm not sure why only those 4 fingers were affected, but that's how it's always been. Before I did the surgery, they were numb and tingling, and the tingling part was the issue, especially when I was sleeping. It would keep me awake most nights, where I would be squeezing or biting my fingers trying to get it to stop. So because of that, we decided to do the surgery. But because of my surgical history with my portacast, my doctor decided to keep me awake for this procedure. The procedure itself wasn't bad, mainly because they let my mom in the operating room, so I wasn't as scared. But what they had to do before was terrible. Obviously, they numbed my wrist up before the procedure, but what they had to do sucked. It was a big old syringe that I want to say was a 2-inch needle that was just repeatedly stuck into my wrist and moving around the needle while it was in my wrist. There was a lot of screaming, so let's just say it hurt a lot. Fortunately, though, the procedures were mostly a success. The amount of feeling that I had in my fingers still remained the same, but the tingling went away. Recovery with the first wrist was slow because I was scared to move my hand too much, but when I went back to get my stitches out and I could barely move my hand, they encouraged me to move more for the next one. So I did just that. Next up is another portacast surgery. My first portacast only lasted about 7 years, and to compare, I've had this one for about 12 years now. The usual procedure for an infusion is to access it, make sure you can pull back blood out of it, flush it, and then start the infusion. We knew we had to change it because for a few weeks there, my nurse was having trouble pulling back blood from the port. The surgery was at the same hospital with the same surgeon who actually remembered me. This time, though, I was doing this surgery awake. This procedure didn't hurt as much as the carpal tunnel surgeries. They numbed the port area, which only involved a tiny needle, gave me something that helped me relax real good, let my mom in the operating room, and away they went. I don't know what I felt that made it hurt like hell, but I think it was when they pulled out the old porticast. That was the only real pain that I felt through that whole thing. Like I said before, this port has been going for about 12 years, and hopefully it'll last for many more. The next surgery is a pretty big one compared to the others, and that would be for my lower back. I deal with back pain almost every day, but it was pretty bad before this procedure. I want to say it started around my mid-teens, but the issue that was causing the pain was a slipped disc, which is where the cushioning between the vertebrae pushes through its outer layer. Of course, I wasn't staying awake for this procedure because it's several hours long, and it involves drilling screws and rods into my spine. I trusted this doctor, though, with my life. He's probably the only doctor that I've ever put so much trust in. My memory is pretty fuzzy after this one because they had me on some pretty good pain meds, but apparently I tried to fight the anesthesia a little bit in the beginning. Other than that, everything went well. The recovery was troublesome because I had to stay in the hospital for 5 days. Then the incision got infected a couple days after I got home, but everything turned out well. Next up is a gallbladder removal, which is nothing compared to the last few surgeries. I don't really think this has anything to do with my MPS, but just wanted to include it anyways. I felt stabbing pain in my stomach where I was just kneeling over my bed a couple times during one night. So during an infusion, I had an ultrasound done on my stomach. The doctor found gallstones, and we just ended up getting the whole gallbladder removed. This surgery went well and had no issues, but I did have to stay the night. They wanted to play it safe and keep an eye on me for the night, which it is better to be safe than sorry. There wasn't really much of recovery for this one. I just have to watch the fats in my diet now. Next procedure is a wisdom teeth removal. I want to say that MPS could have played a role in this, since it does affect bone structure. The only reason I suspect MPS is because I ended up having 5 wisdom teeth when you're normally supposed to have 4. For this surgery, though, I really liked the surgeon and the anesthesiologist. They were very accommodating, and the anesthesiologist even took one look in my mouth before the surgery and knew exactly which tube to use. I thought that was pretty cool. Recovery for this procedure was pretty simple, with just eating softer foods for a few days before going back to eating normally. Last but not least, this procedure is called a septoplasty. This procedure is where the surgeon corrects a deviated septum, which is where your nasal septum is off center. For as long as I can remember, I have been a mouth breather, but that's because it was hard to breathe through my nose, especially through my right nostril. I've had x-rays done in the past in my face area for headaches, and none of the doctors have mentioned deviated septum until my current ENT doctor. For this surgery, after I spoke to the anesthesiologist, he had me huff on some kind of numbing spray for my throat, which did not taste or feel good at all. This surgery went well, but holy crap, the recovery process for this procedure was probably the worst one. For a week, I had to keep gauze taped to my face because I was dripping blood constantly. I had 2 big tube things in my nostrils to let air in and let blood drip out, which when they pulled them out, they were the size of the cover that you see whenever you open a new stick of deodorant. The worst part of the recovery was the sleeping. I had to sleep sitting up at a 45-degree angle for a week, causing my sleep to suck since it was pretty difficult to sleep while sitting like that. Because of my bad sleep, at one point I woke up in the middle of the night from a dream, and it took me a good 10 seconds to figure out where I was. That part kind of scared me a little bit. But hey, at least I can breathe through my nose a lot better now. That wraps it up for my surgeries. I do expect to have more in the future, with the main one being a hip replacement because that's where my main pain comes from now. The doctors I have been to about it want to wait until it gets unbearable and don't want to do surgery on me because of how young I am. If you have any questions or have any experiences you would like to share, feel free to leave them down below. With that, thanks for watching, and I'll see you later.